This case presentation is a requirement of DEN 056 Dentistry Research 2. This is a recorded presentation of our case report. Diastema closure with direct composite veneers, a case report.
The conflict of interest statement. There were no compromises on the group while making and conducting of this case report.
So in our introduction, as you can see in the picture, a common aesthetic concern or worries among patients is diastema. This case study's objective is to examine the procedure and materials employed on the diastema closure in the patient.
The chief complaint of the patient in verbatim was, "Doc, luhang akong ngipon sa tubangan," which translates to, "Doc, there's a gap between my front teeth." The diagnosis was a diastema between tooth number 11 and tooth number 21 with a gap of 3 millimeters. Another diastema between tooth number 12 and tooth number 11 with a gap of 1 millimeter.
For the treatment, tooth preparation was done for both teeth, maxillary right and left central incisors. For the closure of both gaps, a direct composite restoration was used specifically with a shade of A2. Left photo shows the pre-treatment photograph, which presents a 3 millimeter midline diastema and a 1 millimeter gap between maxillary right central incisors and maxillary right lateral incisors. Right photo shows the post-treatment, which shows the closure of both gaps. For the prognosis, the complaint of the patient was addressed directly through the method used. The choice of color shade and materials resulted to a natural-looking restoration which boosts the self-esteem of the patient. Thus, the patient was very satisfied with the result, thus the prognosis is good.
So diastema has multiple options of treatment, but the patient opted to have direct veneers. Both central incisor surfaces were prepared by being etched with phosphoric acid etching gel for 30 seconds to eliminate the solvent carrier and any remaining water. The adhesive was gently air-thinned. A lead curing light was then used to cure adhesions for 30 seconds. The direct veneers facial surface was then given its final outlines. Lingual region was formed, an interproximal overhang that was very small was trimmed. The contoured surface were then polished and the final surface shine was created. The second central incisor was treated in a similar way and run parallel on the first veneer mesial porous surface. A smooth transition from the natural tooth structure to the direct veneer is made possible by positioning the margins with the appropriate palatal extension. Patient was then advised to visit every 6 months for maintenance.
To conclude, we were able to produce the desired aesthetic outcome and create a natural smile that can boost the self-confidence of the patient. The symmetrical and aesthetic alignment of the teeth was made possible by the use of conservative direct dressing bonding technique. That's all for our case report, and thank you very much for your attention.